I am Dr. Farhad Bukhari. I am a plastic surgeon certified by the American Board of Plastic Surgery. Today I am going to talk about nose reshaping or rhinoplasty. Why it is important? Nose is the central feature of the face. Anywhere where you go to, the people you meet, the first thing they look at is your nose. The other important thing about the nose is that this is the only feature which stands out, is shown in 3 dimensions from the side view, and most of all, people looking at your pictures, again the nose is the feature which stands out. Now what does rhinoplasty mean? Essentially it is changing the nose from what it is to balance your facial features and bring them into harmony. If you have a large nose, we can make it smaller. If it is crooked, we can make it straighter. If it is shorter, we can make it longer. All these things can be done. Now we have many helpful features which can be incorporated. So if you have a large nose, we can remove part of the bone or the cartilage. If it is small, we can add cartilage or bone to it. If it is crooked, we can break the bones to align them in the center. All these things can be done. Now, people ask about whether it is painful. Actually, it is not. During the procedure, you are asleep under anesthesia. Once you wake up, all you have is a splint on the nose and a little packing inside the nose. The packing is removed the next day and just the splint stays for a week. How long does recovery take? About a week to 10 days. Once the splint is off, you can resume your day-to-day activities and you're back to work or school. Rhinoplasty is considered one of the most difficult operations in plastic surgery. Why is that? The problem is that the surgeon has a different idea, the patient has a different idea how their nose should look like. And then you have third-party people like your friends, colleagues. Any comment from them can change your opinion. For example, if you had a surgery done, you go back to your workforce and they say, "Oh, what happened to you?" compared to, "Wow, you look good." You see the difference? Now, how we know before surgery that what we should do to counter that problem? Now we have computer imaging. We take your picture, we change it the way we think it will look good on your face. However, we do need your feedback. We want to know what you want your nose to look like. So then we sit down and work together. That helps us a lot because there are certain things which you may think should be done but cannot be done. Sometimes we have patients who come in, they bring in a magazine, they want to show us some celebrity or actor and they want their nose to look like that. Maybe it's possible, maybe it is not. We'll discuss that with you. What I want to emphasize is that computer imaging is a really helpful tool both in understanding what you want, what can be done, and for the plan.